Mr. Kester.
Hi.
My name's Sarah Kester. I'm going to be the nurse practitioner student taking care of you today.
Good to meet
It's
you.
nice to meet you too. Alright, so what brings you into the clinic today?
I've had some congestion in my nose and sore throat.
Okay, how long has that been going on?
About a week. Right at 7 days.
Okay. Anything make it worse or better?
With the soreness in my throat, warm liquids like tea make it feel a little bit better, and I've been taking Tylenol for the pain.
Okay. And any associated symptoms with that? Any cough, headache?
I've had a cough now for the last 3 days or so.
Mm-hmm. Is it productive?
A little bit.
Okay.
Yeah, I get some yellow mucus up sometimes.
Okay. So just to rehash, you've had like a 7-day history of some nasal congestion and a sore throat.
Mm-hmm.
The warm liquids kind of help that, but what would you say your pain level is with that sore throat on a 0 to 10 scale? How severe is it?
Probably middle of the road, maybe a 5.
Okay. All right. And then the cough started 3 days ago,
Yes,
and
ma'am.
it's yellow productive.
Mm-hmm.
Okay. And nothing, you've not taken anything over the counter, no over the counter sinus or cold medicine for that?
No, just the Tylenol.
Okay. All right. Let's just go in, since it's your first time at the clinic, let's just go into a health history. Okay. Are you allergic to any medications?
Not that I know of.
Are you allergic to anything environmentally?
Pollen and cats.
Okay. And that's just your typical kind of nasal congestion, runny eyes.
Yeah,
Okay.
itchy eyes.
Itchy
Yeah.
eyes. Okay. All right. Any major medical problems? High blood pressure, diabetes, anything like that?
High cholesterol and gout.
Okay. Are you on any medications for those?
Yes, I take medication for both. I take a fenofibrate every day for the high cholesterol, 160 milligrams, I believe, and then allopurinol daily for gout, 100 milligrams.
Okay.
And then as needed, if I ever have a gout flare, I'll take Colchris and Tylenol.
Okay. Any other as needed medications or any supplements, vitamins?
No.
Nothing else over the counter? Okay. Any surgical history?
When I was younger, like 2 or 3, is it 3? I had tubes put in my ears and had my adenoids out.
Okay. Any other surgeries as an adult?
Polynidal cyst removal.
Okay. No major belly surgeries. You
No.
still have your appendix, your gallbladder, all of that important stuff. Okay. All right. No joint surgeries, fractures, anything like that in the past. Okay. Let's go into your family history. Let's talk immediate family, like your mom and dad. Are they still living?
Yes.
Do they have any major medical problems?
My dad has high cholesterol, high blood pressure, COPD, diabetes, and had a heart attack in his early 40s.
Okay.
Probably 43 or 44, I believe.
Okay.
My mom just recently got diagnosed with slightly elevated cholesterol. Other than that, nothing.
Okay. You have any siblings?
One sister, also high cholesterol.
Okay. Otherwise, she's in good health, though?
Yes.
All right, let's talk about your grandparents. You can start with either side you want, maternal or paternal, and talk to me about their major health problems.
All of my grandparents had lung cancer.
Oh, wow. Okay.
All of them died of it, except for my dad's dad died of a heart attack.
Okay. That's some pretty extensive history on both sides. Were all of them smokers?
Yes.
Okay. All right. Moving forward, let's talk a little bit about just your social history. Are you currently gainfully employed?
Yes.
Okay. Where do you work?
I'm a firefighter in Valdosta.
Okay. Do you enjoy what you do?
I do.
Sounds like a fun job.
It can be.
It can be. Yeah. Okay. Do you live alone?
No, I'm married. Live with my wife.
Any children?
No kids.
Okay. Anything that you guys do for fun? Any hobbies?
Yeah, we make do.
Okay. All right. Now, these next questions we have to ask to all patients, so I'm not trying to intrude in your personal business. Do you use any tobacco products?
Not anymore. I used to. I've been quit now for about 8 or 9 years. I used to smoke about a pack a day.
Okay. And about how many years did you smoke total?
4 or 5.
Okay. All right. Any alcohol use?
occasionally.
How many would you say, like a week, if you had to quantify it?
Maybe 6 a week, spread throughout the week.
Okay. Any binge drinking?
No.
Okay. And any recreational drug use at all?
No.
Okay, no street drugs. Now, we do have to ask about sexual history. I'm not going to get into it very in depth. I'm just going to ask if you are in a currently monogamous relationship with either a man or a woman.
Yes, with my wife.
Okay, like I said, we have to ask. That's not an inference. And are you guys trying to conceive or using contraception?
No, we are practicing safe sex.
Okay.
Because we are not trying to conceive.
Okay. All right. We've talked about your medications. We've talked about some history. That pretty much wraps up the history portion of it, and we're going to move straight forward into a review of systems. It's going to give you an opportunity to kind of tell me if there's anything else going on with you today, and it's going to give me kind of an idea of your overall health before we move into your assessment, okay? All right, so let's start. Have you had any headache, any dizziness?
No.
Moving with your ears, any excessive drainage, any excessive earwax, changes in your hearing?
No.
Do you have ringing in your ears?
Yes, usually.
Okay, but
that's been normal for the last several years.
Okay. Any hearing loss that's
No.
typical for you? Okay, just the ringing.
Mhm.
Okay. Any visual changes?
No.
You wear corrective lenses?
Yes.
Okay. Any double vision, anything like that? No,
No.
excessive tearing, drainage, redness, itching?
No.
Any problems with your nose? Any problems breathing through your nose other than?
Just the congestion that I'm here for today.
Okay. Let's see, moving with your mouth, any dryness, any sores,
No.
any issues with cavities, dental issues, anything like that?
Not that are uncorrected.
Okay, alright. Your last dental visit?
About 4 months ago.
Okay. And then let's move to kind of your throat, any swelling, lumps, bumps?
Just some little bit of swelling and tenderness underneath my jaw line right here.
Okay. And that's been for how long?
It's been noticeable since I've had the sore throat, about a week.
Any stiffness in your neck, turning side to side, any pain? No. Okay, we're gonna move through the rest of your systems here kind of shortly. We're gonna touch cardiac issues, any chest pain, any shortness of breath, any palpitations, or heart feels like it's racing, or
No.
skipping a beat.
No.
Okay, you said no shortness of breath. Have you had a cough recently?
For the last three days or so.
Okay. No changes in shortness of breath with positions. You don't wake in the night coughing, anything like that. I'm going to talk about your general overall state of health here. Any of you waking up with any kind of night sweats or anything recently?
No.
Any trouble sleeping, excessive fatigue,
No.
any unintentional weight loss or gain?
No.
Okay. Do you notice that you're hotter or colder than other people that are in the same room as you?
Mm-mm.
No? Okay. Moving on, abdominally, you had any nausea, vomiting, diarrhea?
No.
Changes in your bowel habits, tenderness, changes in the girth? Okay.
No.
That was unintentional. That was not noticeable.
All earned.
All earned. I can empathize with that. Let's talk about joint-wise. Any pain with movement, any stiffness in your joints, anything like that, muscle aches?
No.
Okay, talk about your nails, any changes in your nail beds, color,
No.
texture, okay? Let's see. And again, we have to assess all patients for this, whether or not it's actually a known issue with you or not. We have to assess psychiatric. So have you had any kind of hallucinations, delusions?
No.
You don't have anybody talking to you that, nobody else hears or
No.
sees? Okay, we have to ask. And no suicidal thoughts, homicidal thoughts?
No, ma'am.
Okay, alright. Okay, let's jump right on into our assessment then, okay? Let me get some tools here. First thing I'm going to start out with is just a quick general assessment of your head. I'll get you to turn towards me. Thank you very much. You're fine, get comfortable, We're going to be here for a few minutes. Alright, first I'm just going to inspect. His head is midline and normocephalic. All features on his face appear midline. I'm going to actually palpate your scalp here. I'll get you to lean down. Hair distribution is normal on the scalp. There's no infestations. I'm going to press here on your scalp. You let me know if you ever have any tenderness. There's no indentations, no lumps, no tenderness. Alright, yep, thank you. That's probably a good idea to take those off. Alright, I'm going to inspect your face again. Hair distribution around his eyes, eyelashes, and eyebrows is normal. I'm going to palpate here over your sinuses, your frontal sinuses, and your maxillary sinuses. Any tenderness in there?
No.
What about in here?
No.
Alright, you're going to feel me tap a little bit, okay? Any tenderness there?
No.
Tap. Okay. Alright, I'm just going to pull down on your eyelids really quickly, okay? I'm just assessing for color. Sclera is white. There is no redness, no excessive drainage. His conjunctiva is pink. Let's palpate here over your temporal arteries. I'm sorry.
You're fine.
Alright. No pain there over those temporal arteries?
No.
Okay. And now I'm going to palpate here over your jaw muscle. What I'm going to get you to do is clench to start with. Clench your jaw. Very good. Now can you open your mouth, open and shut? Alright. Just basically palpating your temporomandibular joint here, making sure there's no clicks, there's no pain there. While I'm here, I'm just going to assess your ear. Any pain over your external ear?
No.
I'm also inspecting while I'm doing this. External ear appears normal. There's no pain over the pinna or the tragus. Skin color is normal throughout this exam, or has been thus far. Now we're going to do lymph nodes, okay? I'm going to step forward towards you really quick. You're okay, you're okay. I'm palpating over your occipital lymph nodes here, which are non-palpable. These lymph nodes will be non-palpable unless I comment. Posterior auricular, preauricular, tonsillar are palpable, and about a 2. Or the pain over that, I apologize.
Just a little tender.
A little tender. Submandibular, non-palpable. Submental, non-palpable. Superficial cervical here. Moving down to the supraclavicular. I'm going to have to go inside your shirt here, I'm sorry. Non-palpable. This would probably be a good time for you to tell the camera that you did consent to this exam and to be filmed.
Of course.
Okay. Alright. And let's see. I've already done the supraclavicular. I've done the superficial cervical. I'm going to get you to turn your head towards the camera that way. I'm going to palpate the deep cervical chain here. Alright, before you turn back, I'm going to place my hand on your cheek. I'm going to get you to push your head back against the resistance of my hand, okay? Alright, very good. Continue to turn that way. Same thing on this side, deep cervical chain. Non-palpable. And same thing, I'm going to get you to test that strength, okay? Very good. While I'm right here, go ahead and shrug your shoulders for me, okay? Alright, cranial nerve 11 is intact. We're going to be doing some cranial nerve examinations throughout the course of my exam, okay? Did you have any tenderness during that examination over anything?
Just there.
Just there. Okay. Well, while I'm also assessing your neck, I see that there is no JVD, trachea is midline. There's no obvious thyroidomegaly, no goiter, nothing like that. Skin temperature, hair distribution, all of that is normal. His skin is warm and dry. And now we're going to move forward with a little bit more of our assessment. To start with, we're going to do a quick eye assessment. I'm going to stand about 6 feet away from you. I'm not sure if I'm still in the camera view, but I have a pocket Snell in here. And what I'm going to do is I'm going to get you to, with your corrected lenses, I'm going to test your vision. So I'm going to get you to cover your right eye. We're going to start with your left. Can you read the smallest line there that you can for me?
L, T, F, P, H.
Alright, and if you could switch eyes for me. Alright, same thing. Smallest line you can read.
L, T, F, P, H.
Alright. He read the 20/20 line, which indicates that he has 20/20 vision bilaterally. That means that he can see at 20 feet what a person with normal vision can see at 20 feet. Alright, we're going to move forward and do a quick eye exam. First off, thank you for going ahead and removing those. You're a good patient. It's almost like you know what's coming. Alright, so first off, I'm going to be shining a light in your eyes and I'm going to be looking at your pupils and just doing a quick exam, okay? Alright, so first off, I'm just looking to see that your pupils both constrict in the presence of light. That is obviously direct, they do constrict, and what I'm going to do now is I'm actually going to shine the light into your left eye and I'm going to be watching your right eye to ensure that it constricts, and it does. You can blink for me really quick, and we're just going to test the other eye. Alright, next thing I'm going to do is I'm going to actually shine this light right here and I'm going to bring it towards your eyes. What I'm looking to do is that your eyes do move inward. And that your pupils do constrict to focus on an object that is closer to you, okay?
Okay.
So if you'll just follow right here. Alright. And his pupils did constrict to focus on that object that was closer to him, as well as his eye movements were normal, moving in and focusing on that object. So his pupils were equal round at about a 4 millimeter and reactive to both light and accommodation. Alright, so next we're just going to do the cardinal fields of vision, which what I'm going to do is I'm going to have you follow my pen light with only your eyes, not your head, and we're just going to go in 6 directions out around. Okay. I'm watching his eyes as he goes through this, and I see no nystagmus, no other abnormal movements. There's no drift, both eyes are moving normally. Very good. Alright, and the next thing we're going to do is a quick wiggle test. What I'm going to do is I'm going to check your peripheral vision, okay? So we're going to check same side to same side. So I'm going to get you to cover your left eye, and I'm going to cover my right eye with my left hand. Now what I'm going to do is I'm going to wiggle my fingers, and I want you to tell me when they come into your peripheral vision, okay? I want you to say now when you see them.
Now.
Okay? And if you'll switch eyes for me. Alright. And again, let me know when you can see them.
Now.
Alright, I'm just going to do some different positions here.
Now. Now.
Alright, your peripheral vision is all intact. Now we're going to move to a fundoscopic examination. Typically for a fundoscopic examination, you would dim the lights a little bit in this room. Unfortunately, in this clinic room, the lights are all or nothing. So for the purpose of the video, we are going to leave the lights on. Alright, so what I'm going to do is just check and make sure that my light is working, and it is. My diopter is at 0. Alright, if you will look directly over my shoulder towards that corner of the room for me, it's going to be a bright light. I want you to tell me if I'm ever hurting you. Okay. I see the red reflex. I'm going to move in and follow that in until I see the optic disc. The optic disc is there. It is sharp and yellow. All vasculature appears normal for the purpose of this examination. I'm going to move to your other eye. Are you doing okay?
Yes.
Okay. Alright, same thing. Alright, there's my red reflex. I'm going to follow that in. And there's my optic disc. And margins are clear and sharp. And of course it is a creamy yellow. Alright, that concludes my fundoscopic examination. Next we're going to move forward and we're going to quickly examine your nose, mouth, and ears. Okay, I'm just going to change heads on my otoscope really quick.
Okay.
Alright, so let's start with a quick test of your ears, okay? I'm inspecting his outer ear, appears normal. As we noticed earlier, there was no tenderness on palpation. Alright, let me know if I hurt you here, okay? Pulling up and back. Alright, I can visualize his tympanic membrane. It is pearly gray and translucent. I visualize both the malleus and the umbo. There is no excessive cerumen. And the cone of light is visible, and in his right ear it is at 5 o'clock. There was no excessive drainage, no excessive cerumen, no redness. There was no perforation of his eardrum. I'm going to repeat the test in this ear. Alright. Tympanic membrane is again pearly gray and translucent. I see the malleus and the umbo. Cone of light is at 5 o'clock approximately. I'm sorry, disregard 7 o'clock approximately in this ear. No excessive cerumen, drainage buildup, anything like that. No perforation of your eardrum, which is all good. I'm going to switch heads really quick and just sit this down for our later for a nasal examination. Alright. While we're doing a quick ear exam, I'm going to move forward to a couple more things. One is going to be the whisper test. I'm going to have you occlude this right ear for me, and I'm going to whisper a common two-syllable phrase, and I'm going to get you to repeat it.
Baseball.
Alright, I'm going to switch ears.
Apple.
Very good. Alright, the next thing that we're going to be testing is going to be two tests called the Weber or the Weber, if you're German, and Renee. The first one is going to be the Weber. It includes me striking this tuning fork, placing it just in the center of your head, and I want you to tell me if the sound lateralizes to one ear or both, or neither. Alright? equally in one side, louder in one ear?
Both are the same.
Okay. And the next one is going to be the Renee. What I'm going to do is I'm going to strike the tuning fork, and I'm going to place it on this tiny bone behind your ear. I want you to tell me when you can no longer hear it.
Now.
I'm going to move it forward.
Now.
Okay, what we're testing there is that air conduction is longer than bone conduction, and his was twice as long.
Now. Now.
Okay, very good. I'm going to set this down really quick. I'm going to do a couple things before we move into our nasal examination. If you'll close your eyes for me, I'm going to place something under your nose. It's a common smell that I want you to try to identify for me.
Rubbing alcohol.
I'm sorry about that. I know that's strong. There's only so many ways to test that smell. All right. Again, if you'll keep your eyes closed, this isn't necessarily a smell test. This one is checking one of your cranial nerves, okay? I'm gonna put a light touch of gauze on your cheek, and I want you to identify if it's left or right, okay?
Left. Chin. Forehead. Left. Left. Right.
Okay. You can open back up your eyes. Now moving forward to the nasal exam, okay? If you will lean, or just turn a little bit towards me, please. I'm trying to stay in view of the camera. All right, if you'll tilt your head slightly up for me. You do have a little bit of deviation. Have you broken your nose before?
Yes.
Okay, sorry. Just have to say that for the video, okay? All right, I'm going to press a little bit here on the tip of your nose, and I'm just going to inspect. All right. There is a little bit of swelling noted bilaterally. Checking, let's start with your left nair. It is patent. There's no major deviations there. I'm sorry, no major discharge, just a slight little bit of kind of yellowy discharge. And same thing with this one. Right nair is also patent. Those turbinates are a little inflamed, a little irritated. And again, just very, very mild deviation there, okay? All right. That concludes the nasal exam with my same light. I've taken off the speculum there. What I'm going to do is I'm just going to do a quick oral exam. All right, I'm going to get you to open your mouth for me. You don't have to say I'll just open your mouth up. All right, oral mucosa is pink and moist. He appears to have good dentition. It does have some crowns, some dental crowns. Can you stick out your tongue for me and say ah? I'm watching his soft palate and uvula raise when he does that. One more time, I'm just going to take a quick look at the back of your throat. All right. Tonsils are present, they're slightly inflamed. Of course, his airway does appear patent from this view. Slightly reddened in the back, no exudate, anything like that. All right. One more test while I'm right here. I'm going to have you move your tongue, open your mouth and move your tongue side to side, up and down. Okay, tongue movements are all normal. Any pain with your mouth, anything like that?
No.
I noted no lesions, no abnormalities there. Okay? All right. So let's see. I do still have to do a quick thyroid examination on you just as part of the head to neck exam. So that is going to require me to be behind you.
Okay.
Some people, it can make it a little bit anxious just because I do have to have my hands on your neck, okay? So don't let me alarm you. I'm not trying to choke you. I'm just going to palpate your thyroid here. All right. Can you swallow for me? Okay. No nodules noted on his thyroid, no goiter, no pain?
No.
All right. I'm going to take a quick listen to you while I'm right here. You can breathe normally. You don't have to take super deep breaths. I'm just listening bilaterally, comparing lung sounds in all fields. I'm trying not to obstruct my camera view here too. Always makes for a harder exam. And on your other side. lung sounds are clear in all fields bilaterally. While I'm back here, I'm going to do a couple more tests. What I'm going to do is I'm going to place both hands on the back of your chest wall here, and I'm going to get you to repeat the phrase 99 every time you feel my hands touch you, okay?
Okay.
All right.
99, 99, 99, 99.
All right. And then what I'm also going to check is I'm going to put my hands here along your rib cage back here posteriorly, and I'm going to get you to take a deep breath in, and what I'm checking is your diaphragmatic excursion, and diaphragmatic excursion is equal there bilaterally, okay? All right. Just to rehash, like I said, your breath sounds were clear in all fields bilaterally, so I feel like your junk is mostly up here, your congestion is here rather than in your lungs, so that's a good sign. All right, let me just check your chart really quick. I'll be right back with you. Do you have any questions thus far?
No, ma'am.
All right. So just to rehash, we kind of assessed your cranial nerves as we went through this exam. Cranial nerve 1 was assessed with your smell when you checked the alcohol prep. Cranial nerves 2 and 3 were checking convergence with your eyes. Cranial nerves 3, 4, and 6 were your cardinal fields of gaze, where we did the extraocular movements and checked that those were normal. Cranial nerve 5, we did the light touch. Cranial nerve 7, I do need to check that one. I did check it with the eye strength. Let me check that. You can actually close your eyes. And what I'm going to do is I'm going to put my hands here on your eyebrows, and I'm going to get you to try to keep your eyes closed against my resistance, okay? All right, so that is intact. The next thing I need you to do is look at me and smile really big, frown, and puff out your cheeks. Very good. All right. Cranial nerve 7 is intact. We assessed cranial nerve 8 in multiple ways. Auditory nerve is intact. Cranial nerve 9 and 10, your soft palate rose, of course, with when you said ah. And cranial nerve 12 was intact with your tongue movements, and cranial nerve 11 was assessed with your neck strength and your shrug strength. So everything for my assessment looks pretty good, except for, of course, what you came for. Your throat's a little bit reddened. You don't have any exudate, so I don't necessarily think it's strep, although I probably am going to get them to swab you for strep. Just to be sure. Your vitals were okay. Blood pressure and all is fine, but you were running a little low-grade fever. So that's really the only reason I'm checking you for strep. With the kind of nasal cold symptoms this time of year, we always want to check for flu. I didn't ask you about your immunizations. Are your immunizations all up to date?
Yes.
Did you receive a flu shot this year?
I did.
Okay. We're still going to swab you. It doesn't cover all the strains, so we're still going to swab you for flu. That can be a little bit uncomfortable. The flu swab is a nasal swab, and the strep swab, is a throat swab. We'll get both of those sent off to the lab and treat you accordingly. Right now, what I'm thinking that you got is either just nasopharyngitis, which is a viral kind of common cold thing. You may have strep. We're going to wait on the test for that. I don't think you do, though, with the absence of the exudate. You may have flu, which again I doubt. You don't present with any of the body aches or high fever that's typical of the flu. And the next thing I think you may have is just kind of some allergic rhinitis. So what I'm actually going to send you home, my primary diagnosis is going to be for like a sinusitis kind of thing, or an upper respiratory infection. So I'm going to send you home with some Augmentin. You're going to take 875 milligrams by mouth twice a day for the next 10 days. Really force fluids, try to thin out those secretions so that you can cough them up and cough them out. I'm going to prescribe you some Mucinex that's going to help you kind of expectorate that stuff that's that you feel like is in your throat.
Mm-hmm.
Thin that mucus out so it's easier to cough out. And then long term, what I'm going to try is put you on something like an Allegra in the morning that's for more of an allergic kind of thing. What that'll do in the acute phase of this illness is it's going to dry up some of those secretions and help you kind of get over that, the runny nose part of it. And then long term, it'll help you with some of those seasonal allergies that sometimes you can't knock.
Okay.
So, do you have any questions today about anything we've gone over, anything to add?
No, ma'am.
All right, well, it's been a pleasure taking care of you. It was so nice to meet you. I'll send the nurse in to get those swabs, and once we get everything back from the lab, we'll talk more about your prescriptions, okay?
All right.
All right, thank you. Nice to meet you.